Medicare is a life-saving program for many seniors and persons with disabilities. Do you ever feel like you don't have a say in the future of this vital program? After years of paying into Medicare, you do deserve a voice in its future. AARP's You've Earned a Say is a national conversation committed to providing you with important Medicare facts, as well as information about the proposals on the table in Washington, without the political jargon and spin. AARP believes there are better ways to strengthen Medicare than cutting benefits or forcing seniors to pay higher premiums, deductibles, or co-pays. AARP's You've Earned a Say has sponsored this half-hour show on Medicare to answer your questions about this critical program. Special thanks to Derigo Pines Retirement Community in Orono for hosting AARP. Enjoy the show, and if you have any questions, visit aarp.org/me and earnedasay.org.
Hello, and welcome to this special program brought to you by AARP's You've Earned a Say initiative. We're here today to talk about Medicare, a program that provides much-needed health coverage to millions of Americans. My name is Steve Bowler of Derigo Pines, and it's my pleasure to serve as moderator for this interesting and important discussion. Please join us as we talk about the challenges and prospects for strengthening Medicare now and into the future. We are pleased today to welcome two panelists who will give us an overview of the situation as it stands at present. We'll begin with opening comments from AARP State Director Lori Parham and Wiscasset Family Medicine Nurse Practitioner Rhonda Sullivan. We'll then go to questions from our studio audience here at Derigo Pines in Orono. We would also encourage our viewers to visit www.earnedasay.org for more information about the future of Medicare and how each one of us can play a role in this important discussion. We'll begin with Dr. Lori Parham, State Director of AARP Maine, which represents more than 230,000 members statewide. She has worked in AARP's national office in Washington, D.C., and has also led AARP work in Florida. Dr. Parham has extensive experience in health, long-term care, and end-of-life policy decisions. Over the course of her career, she has worked as a researcher, policy analyst, and advocate for older people. Lori, welcome to our program.
Good morning, and thank you, Steve, and it's great to be here with Rhonda, and it's great to have you here as well, the residents of Derigo Pines. And I'm just thrilled to be here to talk about this program and hear from you because I hear from many of you and others around the state how important Medicare is to you. So you probably know this, but Medicare was established in 1965 to provide what the private market didn't provide: adequate, affordable health care to older Americans. Here in Maine, more than 271,000 people are enrolled in the Medicare program. That's a large number. And Maine is the oldest state per capita. Medicare helps pay for hospital bills, doctor's bills, and the costs of needed medications for those who choose to purchase the optional Part D coverage. Workers pay into Medicare their entire working lives so that Americans age 65 and over, as well as people with disabilities, can access the program. You paid in over your working lives. Worker contributions, government funds and payments, such as for premiums and co-pays, from people enrolled in Medicare fund the program and the health benefits people count on when they grow older. Medicare does have some challenges ahead, and we can't ignore those challenges. For one thing, the total number of Medicare beneficiaries across the country is expected to double from about 40 million people to 80 million people between the years of 2000 and 2030. Another challenge is the cost of health care, not just in Medicare, but in the overall health care system. Over the past decade, healthcare costs have continued to grow dramatically, increasing both the overall cost of the Medicare program as well as the amount that many of you pay out of pocket. Although Medicare's costs have grown more slowly than the entire healthcare system, the expenses are still there and they're outpacing inflation, and we have to look at this issue. One of the greatest drains on Medicare is fraud and waste. Literally billions of Medicare dollars are lost each year due to fraud and waste. Money that could otherwise be spent on improving and expanding healthcare services and would help keep your healthcare costs down. With so much at stake, the decisions about Medicare's future deserve close attention and active participation by folks like you, your friends, and your neighbors. We want to ensure that Medicare remains strong for you and for your children and your grandchildren going forward. So I look forward to the conversation today. Thank you.
Thank you very much, Lori. I think you brought up some interesting things that will be good for a conversation today. And now we'd like to welcome Rhonda Selvin. She is family nurse practitioner with Wiscasset Family Medicine, who's been in practice in the Mid-Coast area for 17 years. Ms. Sylvan is currently the president of the Maine Nurse Practitioner Association, serving on several state committees and working to transform the delivery of health care with Maine Quality Counts. She is especially interested in the care of Maine's elders. Welcome, Rhonda, to the program.
Thank you so much for having me. My focus is a little bit different, I think, than Lori's, and so I think it's a great counterpart to have us together, because what I do every day is take care of people. And when I go into each room and hear the stories that families have that are so much broader than just what a healthcare specific issue might be that day, they affect our nutrition and our transportation and how we interact with our families, our behavioral and mental health. This is the kind of care that we as providers hope to give to all of you. And while I tend to be fond of children, my real dedication is to taking care of elders. And it's so important to hear from you the kinds of ways that we might either better deliver your care or better explain the kind of care that's available to you. And I think Medicare, along with our Medicaid services, is the underlying basis of that care. And it's so important that we understand what it provides to us, how broad-reaching it is, and at the same time work together to know that we have a voice in being able to make changes, improvements, that cost sharing or cost savings doesn't always have to come from cutting care. So that's why I'm here today. I'm happy to entertain your questions.
Thank you very much, Rhonda. I think it's really good to have somebody here, too, with that more of a personal, hands-on touch, too, here, too. So at this time, we're going to open up discussion with our studio audience. Any questions?
This question is for Lori. Is Medicare in financial trouble?
Thank you for that question. As I mentioned earlier, Medicare does have some financial issues that we need to look at. The Hospital Insurance Trust Fund, this is the trust fund that funds your Part A hospital care, based on the latest projections for 2013, can pay full benefits until 2026. That's not that far down the road. After 2026, the trust fund can pay out at 87%. And so this is something that we're going to have to look at. We are going to have to look at how we bring costs down and how we do this without balancing those changes on the backs of seniors, many who are very low income and are already finding it hard to make ends meet. Thank you. You're welcome.
My question is also for Lori. I hear a lot about proposed cuts to Medicare that might affect my benefit. Is this really true?
There is a lot. You've probably heard about some deficit discussions going on in Washington. There's a lot of debate about the deficit and what causes it and how we fix it. And so in those discussions, healthcare is a large part of what we hear, and specifically Medicare. And so over the last number of years, there have been proposals on the table that have been debated that would change the program. So for example, some folks think that if you make more money in retirement, that you should pay more in premiums and co-pays. Other folks believe that you've paid in all your working life, so just because you're doing a little bit better than others in retirement, you shouldn't have to. And so you've got both sides of that equation. There are also proposals on the table that would mean if you have home health care, you would have to pay a copay for your home health care services. Also, the potential of paying copays for a short-term nursing home stay, a rehab stay, those first 20 days that Medicare covers. A lot of folks are concerned about these potential costs because of the low incomes that many seniors have, and because on average, Medicare out-of-pocket costs are about 20% of a senior's income. There are also proposals on the table that would deal with some of the fraud issues that we know the program faces, that would increase penalties on people who are convicted of Medicare fraud in the hopes of deterring folks from actually engaging in Medicare fraud. So those are just some examples of what's in play, and it's really important for you to know because it could have an impact on you going forward.
My question is for Rhonda. I've heard that some doctors are not taking Medicare patients anymore. How is that possible?
Well, thank you for your question, and it's certainly an important one. Well, I think that in Maine, this is less of a problem than it is in many states. The way that this is possible is that doctors and providers of all types that have primary care practices particularly are under these same kind of fiscal constraints that most of us are in the healthcare system. Reimbursement rates are set by the Department of Labor and revisited for Medicare reimbursement and for reimbursement from all different insurance companies, and they can change from year to year. In some insurance companies, they're much lower than others, and this becomes a problem for practices that are trying to give the best care to the broadest audiences. So it is possible that a doctor or a nurse practitioner could say, no, I can't take any more patients from this type of insurance. That is possible.
This question is for Rhonda. How is Medicare funded?
Medicare is funded by the Centers for Medicare and Medicaid Services is a branch of the Department of Health and Human Services, and which funds and monitors the whole program of Medicare. And it's paid for by two trust funds that the U.S. Treasury holds and that are reserved strictly for Medicare costs and administration.
I'll just add a couple of things to that. I mentioned this earlier, but it is important to recognize and remember that wage earners pay into Medicare their entire working lives. They actually split what they pay in with their employer for a total of 2.9%. And there is no cap. So if over the course of your whole working year, any tax year, you are paying towards the program. And actually in 2013, and this is something folks are going to be figuring out when they do their taxes this year, there have been changes that have increased costs for higher income folks. If you make $200,000 or more as an individual, or $250,000 more as a couple filing together, you will be assessed an additional almost 1%, 0.9% in taxes. And so, we continue to make sure that people understand this is a program that folks have paid into, that they deserve that back in care later in life.
Hi, this question's for Lori. Is everyone eligible for Medicare?
Everyone is not eligible for Medicare, and this is a complicated question. You do have to be a U.S. citizen or a legal resident with a green card to get to have access to Medicare. You can be a U.S. citizen living abroad and have access to the program. You must be 65 years of age or older, or if you have a disability and are under 65 and meet certain requirements that are pretty difficult to meet, you can also have access to the program. Also, you have to pay in, you have to work, or your spouse has to have worked 40 quarters, that's 10 years. But there are different calculations depending on how long you may have worked or if your spouse worked. Beyond that, a lot of folks don't understand that you are automatically enrolled in Part A, and what you pay in your working life goes to fund your hospital insurance, Medicare Part A, through the Hospital Insurance Trust Fund. You don't have to sign up for Part B or Part D. However, you can be penalized if you don't sign up for Part B or Part D, or you wait to sign up. If you are one of those folks who wants to work past 65, or frankly has to work past 65, and you have employer-sponsored coverage, then you can delay Part B without a penalty. So those are some of the rules. A lot of it is very much based on individual circumstances, but some of those key components that I mentioned at the beginning in terms of age and citizenship status are across the board.
This question is for Rhonda. What can any of us do to stop problems with Medicare fraud?
That's a really important question, and I think there's a lot that we can do. We can realize that we have a choice in our health care. We can realize that there isn't always one right answer to a situation. When we have a visit with our provider, we can make sure that they have the time to really discuss with us what's wrong today, or how does this tie into our overall health care and our overall health. For example, one of the programs that I work with Maine Quality Counts, which is a healthcare collaborative that is built to bring together the people that get health care, provide health care, and pay for health care across our state to try and improve care, reduce costs. One of those enterprises is called Choosing Wisely, and it's a campaign for patients and for all of us, but also for providers to better educate us about how to treat, for example, low back pain. Every incident of low back pain doesn't need an MRI, but often in a 15-minute visit, or if we don't have the full story or the history from our patients, these kinds of tests are being ordered. And if we don't have good conversations with other providers that are giving care to the same person, the test could be ordered again and again. These are the kinds of things that all of us can do to try and decrease cost, but it really improve our care. It's not a way to restrict services or in any way decrease our quality. It's a way to improve our quality and decrease our costs. So that would be one example. Another program that I work with right now is called Transitions of Care, and the effort is to try and improve the communication between our family members, our other advocates, and our entire system, the specialist, the hospital. When someone has to go either from the hospital to home, from a skilled rehab facility to home, we often aren't following people or helping them understand what their medication lists mean. If there have been changes, they may be going home without their prescriptions that they need to continue, or with some confusion about that. So it's an exciting question to me, because I think the short answer is there's a lot of things that we can do. And these are two examples of them.
And from a consumer perspective, it's so important, and we actually work very closely with Maine Quality Counts on a number of initiatives. It's more and more important for you to be involved in your health care, because you, through your explanation of benefits that you get from Medicare, are the first line of defense against Medicare fraud. Think about the $98 billion in fraud and waste that could go back yearly, that could go back into better care for you. We process 4.5 million claims a day. That's pretty easy to hide behind. And so it's really important that you're involved. There are great programs like Senior Medicare Patrol that help seniors understand their explanation of benefits and help you become fraud fighters. And that's so important. And then, can you believe your Social Security number is on your Medicare card? So we are looking and working with members of Congress to see if we can come up with a part of the number or something that doesn't make your Social Security number so accessible to people who want to take advantage.
Okay.
have a question for Lori. Once you're on Medicare, is there a chance that you can ever lose it?
So you are automatically enrolled in Part A, and your premiums actually come out of your Social Security check. What you have a given set of guaranteed benefits under Medicare, but as we talked about earlier, there are proposals on the table to change those benefits, and so you could see either, in the best case scenario, an expansion of benefits. Wouldn't you all like if hearing aids were covered by Medicare? You know I hear so much from our members about dental issues, hearing aids, some of the vision issues, but given what we're seeing in terms of problems with the program, more of the discussion has been around changes, and so nothing is set forever, and so you could see fluctuations in what is covered or how much you're paying for what's covered, and that's why it's so important for individuals to be involved and following what is happening, which I know can be hard to do sometimes. There's so much noise out there that it's hard to kind of separate the noise from what's really going on.
This question is for Rhonda. What if we change the eligibility age of Medicare? Would that fix the financial challenges?
No. And Lori may wish to address this as well, but no, I think that all of us need care, and so we need to develop programs that can give good quality care to all of us. And in my mind, it's just a cost shifting mechanism. If we raise the eligibility age by 2 years, I think the figures are about a $2,000 shift, but the care is still needed, and I don't think it's a solution to the problem.
And I would say I got a call from a gentleman yesterday who saw that we're doing some work on older worker issues, and he said, I can't find work. I want to work. I'm 57 years old. And so what we're finding more and more is there's this group of individuals between the ages of 50 and 64, especially the 60 to 64 year age group, who have been out of work due to the Great Recession, can't find work, and are counting the days towards Medicare eligibility, who are spending their savings, if they have savings to spend, are going without health insurance, which just shifts costs to the program once these individuals enroll. It also shifts costs to the employer, who will have to continue to pay for these folks who will have increasing chronic conditions. And so you really have to, folks who support this, this type of initiative say, well, fewer people will go into the program, so we'll just save money. But you have to think about the broader healthcare system. Medicare is one piece of the broader system, and where the other impacts will be.
This question is for Lori. What did people do before there was Medicare?
Well, that's a great question. And I will say this, you are very fortunate to have access to Medicare, and I'm planning on the program being there for me when I turn 65. Before Medicare was passed in 1965, more than half of older Americans did not have access to health insurance. For those who did have coverage, they paid more than 3 times as much as younger people. That's what the insurance companies charged them. And we have a special story at AARP. Our founder, Ethel Percy-Andrus, actually was moved to fight for a program like Medicare because she found a retired educator colleague who had spent her savings and healthcare costs literally living in a chicken coop. This was in California. And she felt that no one should have to live this way. And so it was a real struggle for older Americans. And we also know that even though many older Americans and older Mainers are still struggling, even with Medicare today, that it really has helped to lift a lot of older Americans out of poverty. There's always more we can do, but it has made a real difference.
I just wondered what you think the impact will be on the well-being and safety and health care of senior citizens if we have reductions in Medicare.
I think you will know that our answer will likely be that it will negatively impact all of those things. And it will negatively impact our communities and our family structures. And I would argue that it would negatively impact our children as well. I mean, we have a lot of elders caring for our young ones. When we start to break down those support systems, it affects us all. And it's a very short-sighted view to not recognize that, I think.
And I would say that, first and foremost, we can't ignore the fact that Medicare has challenges. But I think, you can look at what the responsible solutions to changes in the program will be versus the irresponsible programs. Where are we just cost shifting? Where are seniors, is there the potential that we're going to balance the budget on their backs versus other places, like bringing down the amount of fraud in the system, bringing down prescription drug costs. Secretarial negotiation is one of those policy changes that you hear discussed, where we could harness the power of the millions of people in Medicare who use prescription drugs to bring down the cost if we can just convince the pharmaceutical industry that this makes sense, which will be tough to do. So we can't ignore the problem, but we need to look at responsible solutions. The work that Maine Quality Counts is doing. An antibiotic does not treat a cold, and it can have long-term effects on an individual. How many MRIs are you getting? What is that radiation doing? How do we ensure that physicians have the time to have real conversations with their patients? We know the patient-physician relationship is a hugely important relationship, and so how can we create space for that? How can we focus on preventative care? We must look at a broad set of solutions. We can't afford, when you've got the median income for seniors is $20,000 a year. Here in Maine, when a large majority of seniors are living just over $1,000 a month, only getting Social Security, there isn't much room to ask them to pay more.
I want to thank our panelists today, Lori Parham of AARP Maine and Rhonda Sullivan of Maine Quality Counts, very much. We appreciate that. I'd also want to thank our studio audience here today from Darragh Pines Retirement Community in Orono. You've been a great audience here. And also, as far as if you want to follow up on more information out here, you can go to www.earnedasay.org or www.aarp.org/Maine or ME. So we appreciate that very much and look forward to future programs like this. Thank you.
Thank you.
Thank you all.